Okay, thank you, Shariki. A really excellent start to our workshop. We have a big charge and a big agenda, so we're going to get started. I am pleased to be on the standing committee, and I'm at UC San Diego, and also I'm Director of Active Living Research. And so this panel, the longer name is a little bit of physical and social environments related to physical activity. And I'm going to just set a couple of outlines here. And I'm dealing with the recommendation number 1 from the Accelerating Progress in Obesity Prevention. And it states this, as you see: communities, transportation officials, community planners, health professionals, and governments should make promotion of physical activity a priority by substantially increasing access to places and opportunities for such activity. So we're going to focus on improving equity of access to places and opportunities for such activity. And so we're going to focus then on the disparities in built and social environments and propose some ways of how to promote equity in such access. I want to just show you a few slides, a little evidence showing that there is not equal access to places for physical activity in our country. And there are a number of studies, but I'm just going to show you a series of studies from a series of slides from a study that we've done in 2 parts of the country, around the Baltimore, D.C. area and around the Seattle, Washington area. And these represent ratings on surveys of about 2,200 adults. So I'm not going to deal with the walkability or the overall design of the neighborhoods or the communities that these people live in, but I want to show you some of the details, some of the other factors that in fact are more amenable to change. And so, as an example here, we see walking and cycling facilities. So this is basically sidewalks and any kind of bike facilities. And we're showing this by walkability, but the key here is we're looking at income differences. And you can see up in the right corner that the income effect is significant. In the high income neighborhoods, they rate having more and better sidewalks and bicycle facilities. So this is important for people of all ages. Pedestrian and traffic safety. Again, you see a very strong income effect here. And there's 2 parts of this. One part of it, of this scale, is about the volume of car traffic and the speed of that traffic. The other part is about facilities that are mainly at intersections to help people cross streets safely. So are there crosswalks? Are there pedestrian signals? Are there islands in the middle of big streets in case people can't get all the way across? So it's really about making a safe transportation environment. And you see here very large differences by income in both the high and the low walkable. Neighborhood aesthetics. And so it might be not surprising that in low-income areas, the aesthetics are not as nice as in high-income areas. But it's important for physical activity because the aesthetics of the environment happen to be a consistent predictor of physical activity in those environments. So it is related to ability to be active. Safety from crime. So we're seeing a bit different, a little bit different pattern here, but as we would expect, a very strong income difference. And there's no walkability difference at the high incomes, but you can see in the low income group there appears to be a difference, although it's not significant. There's not a significant interaction. It looks like the fear of crime is actually higher in the low walkable areas. But the main issue is an income difference. These are from a list of activity-related facilities in the neighborhood. This is a wide range of destinations that people could go to, and you can see there are more activity-related facilities in the high-income areas again, and it's very significant. So an average of about 1 or 2 facilities difference. This one is looking specifically at park access. This is reported park access. Do you have a park within a 20-minute walk? And in this case, there is not an income difference. This is an area that's been studied quite a bit, and there are, most studies show an income difference or a disparity. Not all studies do. This is one study that did not show such a difference. If we look at private recreation facilities, such as a gym or fitness facility within a 20-minute walk, we see that the income difference is marginally significant. So there's certainly a pattern of differences, and you can see that it also varies by walkability. So that is to show that there is a problem here in access to places to be active, to environments that make it convenient, safe, attractive to be active. So now I want to go back to the APOP report and give some ideas about accelerating progress in reducing disparities in access to physical activity environments and enhancing equity. So I'm going to go, the APOP report has 4 strategies that are identified. For each of those 4 strategies, I'm going to just propose for discussion later strategies that can be used specifically to improve equity and reduce disparities in these areas. So the first strategy is enhance the physical and built environment. So that's quite broad, so there's a number of things that we could do for different aspects of the environment. We could target funding for sidewalks and bike paths to low-income and mostly minority neighborhoods. We showed a disparity. Targeted investments to improve that would be reasonable. We could improve the safety of street crossings in these same disadvantaged neighborhoods. We could target traffic calming around schools and parks in low-income and mostly minority neighborhoods. Traffic calming is a way of slowing down traffic. It's a central part of safe routes to school to make a neighborhood safer. We could target support for joint use agreements in neighborhoods without parks. So there are many neighborhoods without parks that tend to be in low-income and Hispanic or African American neighborhoods. Joint use agreements is a way of using school grounds that are in virtually every neighborhood. Almost every neighborhood has a school. So joint use neighborhoods allow for the community use of those public facilities. We could build parks and playgrounds in vacant lots. In low-income neighborhoods, there are abandoned buildings or vacant lots, and there are a few places around the country that are putting playgrounds and pocket parks in those areas. We could improve physical activity facilities in parks in low-income and mostly minority neighborhoods. So this gets at the idea that there might be disparities in the quality of parks across neighborhoods. We actually don't have good data on that yet, but this would be a way of, at the very least, enhancing the quality of parks in disadvantaged neighborhoods. So some targeted strategies there. Strategy 2 in the APOP report is to provide and support community programs designed to increase physical activity. So here are some suggestions for this. provide free after-school activity programs in parks and school grounds in disadvantaged communities. We could target training in physical activity leadership to after-school staff serving low-income and mostly minority youth. We could encourage youth sports organizations to offer programs to youth of all ability levels, not just highly skilled youth, and offer those programs on a sliding scale. We could encourage youth sports, dance, and martial arts programs to adopt provision of physical activity as a primary goal and thus provide sufficient activity to participants. And right now, providing activity is not a goal of most of these types of youth programs. Strategy 3 is to adopt physical activity requirements for licensed child care providers. So a couple of ideas here, and I'm sure you could think of others for the discussion period. We could add physical activity requirements for Head Start programs, and now there aren't any such requirements, and then importantly provide resources and training to implement them. So Head Start would clearly target low-income youth. A second one is to target training in physical activity leadership to child care providers who are serving low-income and mostly minority children. The fourth and final set of strategies in this recommendation is to provide support for the science and practice of physical activity. So a few targeted ideas here are to recruit and support students from underserved racial and ethnic groups to major in physical activity related disciplines, and so to create a pipeline that would lead to more investigators from the affected communities. Another option would be to expand NIH minority supplement programs to make those available to more people. We could add potential to reduce health disparities as a criterion for evaluating grant proposals. We could target training to physical activity practitioners serving low-income and mostly minority youth. Actually, that sounds like not a research one, but one from a previous slide. So anyway, there are things that we could do to improve the science as well as the practice of activity. All right, so that is my overview and suggestions that we can come back to later. And we have two really outstanding panelists who are among the very best qualified to talk on this topic. And they're both going to be focusing on parks and recreation facilities, I'm fairly certain, and not some of the other more transportation or community design issues. So we can also talk about other physical activity environments in the discussion time. But let me briefly introduce these panelists to you. We're going to begin with Robert Garcia. He is a lawyer by background. He is the founder, executive director, and counsel of the City Project in New York. In Los Angeles. Sorry about that, Robert. So he runs a quite unique, I think, organization that's focused on reducing disparities and increasing access to healthy environments, and especially physical activity environments, and especially parks. And he will tell you not only why he's doing this, but how he uses research and some substantial successes that he has experienced in his work. Our second panelist is Myron Floyd. He's a professor in the Department of Parks, Recreation, and Tourism Management at North Carolina State University. He is one of the leading researchers on parks and health outcomes, especially concerning physical activity, and he has special expertise and evidence about disparities in parks, how people in various racial and ethnic groups use parks, and so he's a very suitable speaker to point to solutions in the topic that we're discussing today. So with that, I would like to bring up Robert Garcia, and please welcome him with some active applause.